Well, welcome to all of you. And I say this is the first press conference I've done in Cedar, but because I've only been here 8 weeks, I suppose that's not surprising. But it's nice that the first press conference is a good news conference. So I think that's really appropriate. Let me just begin by explaining the bones of the agreement we have with CVHT, and then I'll hand over to Nick. You will be aware that we entered mediation with CVHT, and today is about sharing the outcome of those discussions. I'm delighted to inform you that both CVHT and NHS Surrey have approved an agreement which enables us to move forward, and it's a very good outcome from the discussions that we undertook. Let me just try and give you the bare bones of this. You've got stuff in your pack, but I'll try and explain just the key points. That's fine. The plan is to now redevelop the health centre on its existing site. The GP surgery is now be on its existing site. That requires a new business case to be put to the board of NHS Surrey, and as soon as that can be prepared, that will be considered by us. Cranleigh Village Hospital will be retained by NHS Surrey and will provide a temporary home for the GP practice whilst work's taking place on rebuilding the existing health centre. CVHD may build a new health facility on the site in Knoll Lane and make that premises available to the NHS in the future. Our focus now is putting energy and pace to get the business case prepared, to move forward and to get the health centre redevelopment. So I'm sure you'll agree this is a good outcome for Cranleigh patients. And it's also good news. We put an end to the judicial review, and we're putting all our focus onto moving forward and preparing a case, and with that we'll obviously be liaising closely with colleagues at CVHT. So that's the bare bones. I'll pass over to Nick, and then I think we're going to get to that after.
Thank you very much, David. It's certainly like you, the first press conference. I've never been in this situation before. But we are, as CVHT, highly delighted with the outcome of the discussion with the PCT. It is, to us, a very good day for Cranleigh, and particularly, well, for the Cranleigh community and the NHS Surrey. This agreement opens the door for a speedy progress. What I would like to do is to actually hand you over to Diane Davis, who, apart from being one of our trustees, he's also the chair lady of the League of Friends. So could I pass?
Thank you, Nick. Yes, I'm chair lady of the League of Friends at Cranleigh Village Hospital, and we regard this as a very, very positive development. We have had very useful and helpful talks. We will be working very closely together now, and I think we will be able to deliver a very positive outcome for the people of Cranleigh, both patients and the people in the community who have supported us so very generously for so long.
Thanks, Anna. I'll just hand over to Cliff.
Good morning, everybody. I'm chair of Surrey Links. This is really fantastic news for the patients and Cranleigh community. As you know, Surrey Links represents patients and community interests within Surrey. We have been and we are fully supportive of Surrey NHS in their consultation for the model of care for Guildford and Waverley, and particularly their approach to co-design services, particularly with the clinicians, patients and the public as a whole. We are very pleased with the overall level of engagement. But this is important. This agreement will secure the health facilities for Cranleigh for the foreseeable future, which is absolutely very good. And I really look forward to continuing working in partnership with the NHS and the community for the future redevelopment of the health facilities at Cranleigh and moving positively forward as quickly as possible. Thank you.